Hi everyone, I'm Jamie Renbarger, founder of Karuna Precision Wellness Center. I hope everybody is doing really well and weathering the craziness of the COVID surge that we're going through right now. And I wanted to actually talk a little bit about that and specifically about vaccinations in cancer patients, either during cancer treatment or after cancer treatment for the flu and for COVID. You know, as probably many of you have experienced, during cancer treatment, the vast majority of vaccinations are put on hold, either because they're contraindicated because of safety or because they're not necessarily going to be effective because the immune system is impaired during many cancer treatments, resulting in potentially less efficacy of the vaccine in somebody during or for a period of time after cancer treatment. The flu vaccine is one exception to that rule, where we know, or it was one exception to the rule of holding or skipping vaccinations, because we know that the influenza vaccine does not involve use of a live virus. And while it may not be as effective in someone during cancer treatment or in someone whose immune system isn't functioning well, as in compared to someone with a healthy immune system, the potential for it to benefit, even provide some small amount of benefit, outweighs what's known to be a very low risk for harm related to the influenza vaccine. And so certainly from a safety perspective, the flu vaccine is not contraindicated. It's generally considered safe to give and can be effective. And so, I recommend flu shots for all of my cancer patients. And in particular, if for any reason it's not safe or not going to be beneficial, for example, in someone during intensive chemotherapy or immediately in the period of the few months post stem cell transplant, then definitely we recommend giving the influenza vaccine and not the live virus version, the intranasal influenza vaccine that used to be available, but always a killed virus to all family members and close contacts of someone going through cancer treatment, as a way, again, to provide protection to the cancer patient from any close contacts getting influenza. All right, so bottom line, always important to talk to your healthcare provider, your oncologist, to confirm their wishes and their recommendations. But influenza vaccine is definitely one that we know can be safely given during cancer treatment and may be beneficial as well. COVID vaccine, as you may have been seeing or you may have observed over the last number of months, this is vaccine development that's happened very quickly and at the same time very safely. So I personally, fortunately, haven't been impacted personally by cancer and plan to get my COVID vaccination as soon as possible, as soon as it's available to me. For cancer patients, what we know is that while studies haven't been done in individuals during cancer treatment at this point, and so we don't have experience actually giving the COVID vaccination, the way that the vaccine is prepared, we expect it to be perfectly safe in individuals during cancer treatment, as well as in survivors in the months after cancer treatment. Again, we don't know how well someone whose immune system is impaired because of chemotherapy or radiation treatments or bone marrow transplant. We don't know how well that immune system will actually respond to the COVID vaccine and how effective it will be compared to the general healthy population. However, we can say relatively confidently that the COVID vaccine should be safe in individuals during cancer treatment. So more to come over the next few weeks and months for sure. Keep in contact with your own oncologist for their recommendations. As more COVID vaccine becomes available, in particular for high-risk populations, like those individuals during cancer treatment, and stay safe out there. One thing I do want to emphasize, even in the setting of someone receiving a COVID vaccination, so even if you as a patient during or after cancer treatment is able to receive the COVID vaccination, it is still of utmost importance to continue to maintain good hand hygiene and to wear a mask in any situations where you're around other individuals, in particular in situations where you can't social distance. Because again, we don't know yet, we don't have data on how effective the vaccination will be for people during cancer treatment, and we don't know yet the duration of response. So how long is it going to last? Lots to learn as we go, but still an important vaccination to strongly consider once it's available for high-risk populations. Please keep the questions coming. We're always eager actually to answer your questions as opposed to what's on my mind, and stay healthy.